Okay, all right. Okay, thank you. All right, so good evening, everybody, and welcome to the Testicular Cancer Awareness Forum 2025, which is hosted by MistyBlue Cancer Care Foundation. Tonight, we will be having Mrs. Carol Bihari as our moderator, but she's on her way home, so I'm just going to try and fit into her shoe until she gets there, all right? So April is Testicular Cancer Awareness Month, a time that is dedicated to raising awareness, promoting early detection, and supporting those affected by this disease. Our theme for this year for MistyBlue Cancer Care Foundation is United by Unique, and that reminds us that every cancer journey is deeply personal, yet together we can uplift and empower each other. As the late Stuart Scott once said, you beat cancer by how you live, why you live, and the manner in which you live. Let us treat this evening as a beacon of knowledge, encouragement, and strength. So at this time, I want to flip over to my other shoe and tell you a little bit about MistyBlue Cancer Care Foundation. We are a registered charity entity that has been operating in the parish of Westmoreland and its environs over the last 10 years. What we seek to do is to bring awareness through medical presentation and early screening for all types of cancers, because we are not specific on any particular cancer. And we offer emotional support, and we do some amount of signposting for persons within the parish who may have cancer, have family members who are going through the disease. We were drawn to the concept of United by Unique as this year's theme, because what we do know, regardless of what type of cancer you have or what type of cancer your loved one may be having, we're all united by that uniqueness of having to travel the cancer journey. And we believe that when persons are able to speak about their journey and share it, it can prove rather empowering for others. Okay, it is not the thing where once you have a cancer diagnosis or you have a loved one who has it, that it becomes something that is a shameful situation where you're afraid to speak about it. So through this medium, we hope that persons will become more willing and open to share their journey so that others can learn from them. For this evening, we are going to have two main speakers. We are going to have Mr. Gerald Miller from the Westmoreland Health Department, and we're also going to have Dr. Lincoln Little, who is also one of the directors in our foundation. So what we're going to start off with this evening is Mr. Gerald Miller, who is the Senior Health Promotion Officer at the Westmoreland Health Department. And he will expose to us the cultural perceptions surrounding men's health and the factors influencing their approach to seek medical care. So what do we know about Mr. Miller? Mr. Miller is actually from the parish of Westmoreland, and his educational background is in communication for social and behavioral change, and he gained his master's degree from the University of the West Indies back in 2012 in that field. He also have a diploma in gender and development studies, which he also got at the University of the West Indies, certificate in social work from UWI, and he also has a Bachelor of Science in Secondary Education from West Indies College that is now known as Northern Caribbean University. Mr. Miller is quite proficient in utilizing SPS software, so he has the technological skills that we need, so probably we need to have him over here. He's adept with research skills, and he's quite adept also in communication. Mr. Miller is well known in the parish of Westmoreland because persons who would have heard him on a radio broadcast that he does for the Westmoreland Health Department once per week. And there he uses that platform to bring educational information, not only about cancer, but health information in general. So this evening, like I have said, Mr. Miller is going to be speaking with us as to how we can explore the cultural perceptions surrounding men's health and the factors influencing their approach to seeking medical care. So, Mr. Miller, at this time, you're gonna do your PowerPoint. So do you want me to allow you to share so you can share your PowerPoint, or you're not gonna share? You're just gonna speak from?
Want to bring it up, bring it on, Dorothy?
No, I thought you're not gonna share.
Yeah, man, we're gonna share it. You
So
can bring it on?
you want me to share it for you?
Yes, no problem.
Oh, hold on, because I never downloaded it. I just thought that you were gonna share. So if you are you on a laptop or on your phone? You have muted back, Mr. Miller. Are you on your phone or your laptop? He's gone. You're gone muted again, Mr. Miller.
All right. I'm on the laptop.
Okay, so are you able to? You can go ahead and share. It's easy for you to share, so you can follow as you do. I don't know why you keep muting.
Go ahead.
Yes, what I'm saying is, isn't it easier for you to share than for me to share it for
No,
you?
no worries.
Okay, thanks. Because I have co-hosts, so you can do that. Ladies and gentlemen, while Mr. Miller is getting ready to start sharing his screen, please, if you can use your gadget, or if you want to go the old school way, to use your pen and paper to make note of any questions that you may have regarding his presentation, so that you can ask questions later on in the presentation, okay? We'll have Mr. Miller speaking, and then followed by Dr. Little. And after we have had our two presenters, then we will go through our question and answer session, all right? So. So whilst we are waiting on Mr. Miller, like we said that today, this month is Testicular Cancer Awareness Month. And even though we don't speak about it as much as we speak about breast and prostate cancer, it is very important for us to have that information, because whether we are going to be looking at it from the perspective of being a parent or a teacher or a mentor for our young men, because it is important for us to have the requisite information, because it is with that information that we are able to make informed decisions and to have an understanding as to how and when it is important for us to go and seek medical attention when our males are going through these situations. Are you coming up, Mr. Miller? See, you're still muted. Dr. Jean, are you able to see what I'm sharing from Mr. Miller?
Yes, I can.
Okay, Mr. Miller, you can go ahead. I'm sharing for you while you go. I'm trying to see if I can. Gina, can close back your microphone for me, please?
Yeah, thanks. Good night. Sorry about that technical glitch. I was having a little difficulty bringing up the slides from the desktop.
Yeah.
So I am delighted to share in this afternoon's presentation a very interesting, yes.
Mr. Miller, you're muted again.
You hear me now?
Yes, you're open now because you had gone muted
Yeah, man.
before.
You're hearing me clearly now?
Yes, I'm hearing you.
All right, good. So I'm saying I'm very delighted to be sharing in this very important topic, traditional norms and the Jamaican males health seeking. No, I'm not muted. Yeah.
No, we are hearing you,
Yes.
Mr. Miller. You're not muted.
All right, good.
Are you okay, Sean?
Good, good. So move the next slide, Dorothy. All right, so we have three objectives here that we intend to achieve at the end of this session, and we want you to be able to look at the traditional masculine norms that are responsible for our poor health-seeking behaviors, to discuss the consequences of their poor health-seeking behaviors and their health, and to identify some interventions that can help to address the gaps alluded to. So we want to look in a more fulsome way at some of the traditional masculine norms, and these norms are not something that we are not familiar with because we would have experienced these, including Dorothy, when we are doing our outreach activities. We would have picked up some of these norms which are preventing our men many times from accessing healthcare. And I want to focus on the one about stoicism and how we have been socialized that we as men are tough. I heard that today at a session that we had with some farmers in the Grangeville area. Rather had organized it as a part of their farmers month activities. And I was engaging the men about their health and how important it is for them to pay keen attention to their health. And the elements, the norms that we are familiar with in terms of men are seen as being tough and therefore they don't need to visit the doctor, because if they are seen going to the doctor too often, then that is seen as being a threat to their masculinity, or they have become more emasculating. And so these are some of the real challenges that we face, and these norms have been preventing them from accessing healthcare from time to time. The next norm that I want is self-reliance. We tend to believe that we are independent. Some of us are of that view, and so we don't seek assistance and we don't express that desire for assistance whenever we are having issues relating to our health. We don't believe that we should have those conversations. The avoidance of emotional expression. And this is something that is typical about many males. We don't want to express our feelings. So we could be experiencing depression, and as a result of that, we don't want to share it. We could be having some health challenges, but we keep it as a secret because we don't want persons to formulate, especially our peers. to start to see us as not being strong. And so these things are preventing us, many of us, from accessing healthcare. Next slide for me, Dorothy. The impact. What are the impacts of these poor seeking behaviors on our health and the implication for the issue of our quality of life that we live? Delayed in seeking medical care. And many times we have health challenges and we do not readily go and seek medical attention. And this is typical in our society. We see it in our clinic setting, in the hospitals. We wait until things are more chronic for us to go and seek healthcare. And this is something that we have to pay attention to. Resorting many times to using, I'm not saying persons are not to use the alternative you know, medicine or whatever non-traditional ways that they are resorting to in terms of taking meds. But I'm just saying if we do not see the need to go and seek health care when we observe changes in our bodies. For example, a man might be experiencing blood in his stool or even his urine, and he tries to dismiss it and to use other things to see how they can counteract it. And they will tell you these things. I've heard it even today. Talking to the men about using the herbs and so on. The avoidance of health screening. And this is something that we see from time to time, and Dorothy can attest to that. Sometimes when we are out there, and the men will try to give you all kind of reasons that, oh, I've been to the doctor yesterday or recently, because they want to dismiss you. They don't want to screen. And today it came home very vividly to me. I was talking to the men, and one of them said to me that one of the reasons why we don't want to go to doctor, we are fearful. Fear is the emotion that they dread the most. So what he's saying that when they don't want to know, so they're fearful of knowing about the unknown. And so this is a real challenge for many of them. So the avoidance of seeking health screening is a challenge. And by avoiding screening, then that puts the man at more risk for serious complications later on because the condition was not addressed very early. And so the likelihood now of the person recovering is more serious. And we see this for prostate cancer, wherein our men do not want to screen for it, and especially for the digital rectal. Although we are seeing changes in the attitude of our men, some of them are now readily accepting the digital rectal. And thanks to you, Dorothy, for work that you have been doing at the parish level in engaging the men in different settings, the churches and so we see more men now are responding in a more positive way towards the digital rectal. But we have seen incremental changes in the attitude of our males in this parish, and that is very good. The stigma around mental health, and a lot of persons, and especially as I've said, our men do not want to express their emotions. So there are things that are happening to them, and they are not comfortable discussing it. And they can allow these things to be internalized, and then later on it can have more serious impact on their whole emotional health. So that's important. The consequences of poor health seeking behaviors, poor health outcomes. So when they do not go and seek health care early, and they delay going to seek medical attention. So the health outcomes are going to be bad. So you could have prevented the breast cancer, not breast cancer no, although men can also have breast cancer. But for prostate cancer, which is the most common cancer among our males, and which result many times in premature death. Um, the issue of them not seeking early screening options. Then when the cancer, when the prostate cancer spread to other parts of the body, then that becomes more difficult. Or the outcomes become a little bit, dire. And so it is always good for our men to make the effort to really see early screening options that are available for the cancer that we can screen for as men. So our prostate and for colorectal cancer, we can screen for that. And so we want our men to start to have a different attitude. But as I've said, we are seeing some green shoots, and we hope that we will continue to have that kind of groundswell, where more men are responding in a more positive way. The increased risk of chronic diseases. So when you do not seek, your the screening options that are available, and when you not get your checks regularly, then you have a blood pressure there that is elevated, and that blood pressure can result in you getting a stroke, or it can result in damage to your kidneys. And so it is always in the interest of our men for them to go and seek medical attention. Do not delay. Delay, as we often say, is danger. Untreated mental health conditions can result, and that can result in persons becoming depressed, and the depression might require clinical intervention. And so it is something that we have to pay attention to, and we'll continue to see how we can plan intervention. And next slide, looking at the interventions that we can focus on. Next slide, Dorothy. So the interventions now. So how do we tackle this problem? And we have been at the Westmoreland Health Department and our unit, we have been partnering with Dorothy and other groups to see how, but more so, Miss Satchel, we have been partnering with her in targeting, different groups, the men. We have been targeting the farmers. Now we're working with the farmers. We target the men who work in areas like in the Pan Caribbean Sugar Factory. We target those men because those organizations have a lot of men. And so we tend to be more targeted with our intervention. So organizations where you have mostly men, we try to bring services to them. And that is something that we intend to intensify. But rather also is helping us to achieve that. Male-friendly health services, that's important. Many times the men will say that how the clinics are organized. So it's the whole issue of reorienting our system. The Negri Health Center, they have just started a men's clinic, and that's a good sign. But our facilities sometimes are not male friendly in the sense that the services that we offer, most of the clinics, the services are tailored outside of the medical health clinic, the antenatal, postnatal, child health clinic. So those structures, those arrangements don't really facilitate the men. And as I said about the traditional norms of our men, they come to our facility, they don't want to wait and they want to move. And so if you don't have a service where you can, reach them in a way that they don't have to wait. And that is something that I've picked up. And so we need to look at that seriously. Community-based initiatives like what Dorothy is doing, that is playing a very important role there in trying to target our men, and trying to bring the services to them. And so we will continue to work on that so as to get our men now to see the need, and for them to be able to interact with us, and for us to clarify whatever needs to be clarified. Because there are times when they have certain misconceptions that need to be debunked. And so when we have these targeted activities, it helps in getting to really convince the men and to change their whole perception, outlook in relation to their health. And so we will continue to do that, and we are grateful for this partnership with Mr. Trail. It's the Blue Cancer Foundation. We have been really working in a very strategic way to really get the information out, and we will continue on that part. Any questions for me? That's the wrap for me.
Thank you very much, Mr. Miller, for that very informative information sharing as it relates to our men's health. Because like you rightfully say, you know, that the men are not the ones who readily speak about their health conditions. And we already have a challenge in our society where men do not really get the credit that they actually deserve as it relates to a lot of social issues. So for us to be even having this conversation, what we do hope that even if they are not physically present on the platform, they'll have access to the information so that with time, like you said, that over the years, we have evolved in terms of the information that we have shared and the reception that we have had to that information. And we thank you for that. And we want to just make reference to the words of Andre Lloyd, who says that when we dare to be powerful, to use my strength is the service of my vision, then it becomes less and less important whether I am afraid. So you highlighted, Mr. Miller, that fear is one of the factors that we find to be a barrier to to the intervention work that is being done in the community. And we hope that as we go forward and share more and more information, that fear will diminish so that we can have more sharing and more engaging so that our men will become more empowered, not only for the older ones, but for the younger ones, all right? So we do not have any cancer survivor or cancer patient to give a testimony this evening. So we are going to jump right into having Dr. Little. Dr. Little, if at this time you can spend the time you want to start sharing your PowerPoint, if you're allowed to start sharing or Dr. Little, and then we will hop on to, and while Dr. Little is making preparation to share his PowerPoint, I'm going to invite Dr. Jean Powell at this time to do the introduction for Dr. Little for us while he prepares to start his sharing. Are you ready, Dr. Powell?
Yes, I am.
All right, thank you.
Good night, everyone.
Night.
Wow, what a task. Hi, Dr. Little. So I was given this task to introduce this honorable gentleman, Dr. Lincoln Little, MD. I think Dr. Little has a background issue going on there. Or it's me, I'm not sure who it is.
Dr. Little, can you mute until Dr. Powell has stopped speaking, please? All right, thanks. Go ahead, Doctor. Go again, Dr. Jean.
So Dr. Lincoln Little, MD, who is this honorable, humble gentleman? He's a proud Westmorite by birth. He hails from the humble community of Blackness in Burnt Savannah. Spent his early years in what was called at Gang Basic School and later Mount Grace All Age. His bio is extensive, so I'm just going to give you highlights. Dr. Little migrated to the parish of St. Elizabeth, gaining acceptance to STEPS. We all know St. Elizabeth Technical High School via common entrance back in the days. He was an avid player of cricket, loved the sport, but not only that, he had St. Elizabeth Tech winning the Headley Cup competition 1978 to 1979. And they secured their first victory back then. He not only excelled in cricket, but also in the triple jump in 1975, gained the Class 3 triple jump record and held the title for many years. Moving forward, Dr. Little matriculated and entered UWI to pursue the career and passion of medicine. In his second year there, he was granted the Indian Government Cultural Scholarship to complete his medical training at King's George Medical College in that country. While there, he balanced his time with academia and sports, leading him to being selected as the best student sportsman in 1986. We're not going to think about how old Dr. Little is. He returned to Jamaica in 1988, undertook his medical internship at the Mandeville Public Hospital, and later his surgical residence at the said hospital. In that same year, he was elected as the Central Region representative of the Jamaica Medical Association. In 1990, Dr. Little opened his private practice in the town of Santa Cruz, St. Elizabeth. One of his very first charitable commitment was to return to STEPS and offer medical care and support to the sporting teams there. He is known to be the willing doctor who will travel to meet his patients at their point of need. He's affectionately referred to as Mr. Boy, hi, my boy, by the more mature members of the community, as they all want to lay claim to him. For Dr. Little, this is special. He lost his mother at a very tender age and later his dad. So for him to be seen as the village kid is a great honor. He's loved and appreciated for the work he does in the parish, has not gone unnoticed. In 1992, he was named Man of the Year and was given the award for his outstanding contribution to community development by the Santa Cruz Rotary Club. In the year 2011, when St. Elizabeth Technical High School celebrated its 50th anniversary, he was one of the 6 past students inducted into the newly launched Hall of Fame. Dr. Little is a founding member and director of medical services for the MistyBlue Cancer Care Foundation. The foundation hosts an average of 7 health fairs across the parish each year, offering diagnostic and preventative screening for cervical, breast, prostate cancer, diabetes, cholesterol, heart disease, HIV, and syphilis, and optical screening, among other public education activities. Dr. Little is that one doctor who has been present at every health fair and almost all other events executed by the foundation. His support in service and financial contribution has no bounds. Members of the foundation, executive, volunteer, and partnership agencies have come to respect and depend on his reliability and sensitivity towards those whom he serves. He is a proud father of 4 children and has 1 grandchild. Tonight, for those of us on this panel, please welcome Dr. Little in the most befitting manner by saying, thank you, sir, for your services from the day you started and going forward. Once again, Dr. Little.
Thank you very much, Dr. Powell, for that introduction of Dr. Little. Okay, so Dr. Little, at this time, we're going to hand over to you. Please, Dr. Powell, have you stopped sharing? Yes. So Dr. Little, you can start sharing now.
Okay.
All right. Thank you.
Thank you, Miss Powell, for that warm introduction. Some of the things you say about me, I didn't really know, but one thing for sure, I'm a man that like balls, and I think that's why she asks
Your audio is very bad, Dr. Little. I don't know what is happening.
testicular cancer. As you all know, I'm a cricketer. So I want to discuss testicular cancer. But before I enter testicular cancer, you hearing me clear now?
Yes, it is better
You hear
now.
me clear?
Yes, it's better now. Thanks.
Okay. As I was saying, we're going to discuss testicular cancer. But before we enter the realms of testicular cancer, there are one and two things I want to say about cancer in general. The first thing, definition of cancer. What do you mean?
Little, if you have your phone on, I think you need to either turn it off or move it away from your audio.
What do we mean by saying a person is having? No, my phone is off. I'm on a laptop. Cancer is a large group potentially invading surrounding tissue, thus spreading to other parts of the body. There are many different types of cancer, each with its own characteristic. Different types of cancer are from various causes. What are the main causes associated with cancer? Genetics. We all know genetics play a very important part, especially in colon cancer. Patient who comes down with the HTL virus, they usually end up with leukemia. Environmental exposure, as we get in cases of skin cancer and the famous asbestos cancer. Lifestyle choices, very, very important. As is stated, 50% of cancer are preventable. And a lot of these lie in the lifestyle choices. You look on lung cancer, very, very important. You look on cervical cancer. You look on hepatitis B leading to hepatic cancer. All those are preventable. There are some very interesting statistics concerning cancer which I want to share with everybody this evening. 1 in every 6 deaths is caused by cancer. When I was doing my internship or doing my study at school, the leading cause of death was cardiovascular and cerebrovascular accident. When I was an intern, the wards were filled with people suffering from strokes and myocardial infarction. Now, the leading cause of death is cancer. The most common cancer is lung cancer across all board. Lung cancer is responsible for 1 in every 5 cancer death that we every 1 in every 5 cancer patient that we bury, 1 is because of lung cancer. Highly preventable. And an
You okay there, Doc?
in all age group. Just take a look on the statistics about colon cancers. You see where lung cancer up more to about 11.4% of all cancer. Breast is about 11.7. Colorectal cancer about 10%, and prostate cancer about 7.3%. Asia, of course, Asia have the largest population within the over 1.4 billion and China over 1.2. So they have the highest number of cases, followed by Europe, America, Africa, and Oceania. I can skip this slide. Now we come to the main subject at hand. Incidence of testicular cancer. Testicular cancer amount to less than 1% of all cancer. As you all know, the testes are those organs that lies in the perineum, lying between at the side of the penis. Testicular cancer is the growth of cells that start in the testicle. The testicles, which are also called testes, are in the scrotum. The scrotum is a loose bag of skin underneath the penis. The testicle makes sperm and the hormone testosterone. As I said earlier, it's not a very common type of cancer, and it affects less than 1% of male. But there's one thing about testicular cancer, it can be very vigorous. It affects male between the ages of 15 and 50. But in my practice, I've seen kids up to age 4 or 5 being diagnosed with testicular cancer. What are the factors associated with testicular cancer? There's a myth out there that's saying that, and I can tell you, people who ride cycle and they usually come in late with this condition because they always attribute it to trauma. But I want to tell people tonight that trauma is not a contributory factor in developing testicular cancer. I have seen a lot of, not a lot, I've seen a few patients who have been to my practice because they ride bicycle and they traumatize that area, come in and they say, "Doc, it's because me hurt," when actually what they actually are having is testicular cancer. Undescended testes. What do we mean by undescended testes? Normally, both testes are supposed to be firmly lodged in the scrotal bag. Sometimes, because of developmental problem, they get hitched up in the lower part of the abdomen, sometimes at the top of the scrotum. Those testes that does not find their way where they are supposed to be, that is within the scrotal bag, they are 5 to 10 times more prone to develop cancer. Family history: HIV infection, which is a new addition to the causes of testicular cancer. Obesity, as in all cases. And if you are white, you are more prone to get testicular cancer. Symptom associated with testicular cancer: swollen breasts. This is very important for us as clinicians, because sometimes the patient come in complaining that, because as the earlier speaker said, there's patients who are not interested to tell you about their private part, but they will tell you about, "Doctor, my breasts have suddenly got swollen." And it's a warning sign for us all to investigate those scrotum, because swollen breasts can be a sign of testicular cancer. Lump in the testis. Usually, testicular cancer is usually a unilateral condition. Rarely, it spread to the other scrotum. Pain. Whenever you start feeling pain in a testicle, that means it's advancing. Thickening of the scrotal skin. And of course, in advanced stages, you can have lower abdominal pain when the cancer have spread. Patient develop testicular cancer. What do we do? Of course, the treatment depends on the stage. Localized tumor or easily excised, and the patient usually does very well. Most of them, 95 to 97% of them, live beyond 5 years. If the tumor has spread, surgery along with chemotherapy and sometimes radiation must be used to treat the cancer. Treatment of testicular cancer, as I said earlier, is very, very successful. After doing surgery or chemotherapy or radiation, it is very important that these patients are follow up annually because there's a chance of recurrence. And my references are Bailey and Love Surgical Textbook, Mayo Clinic Register, and Global Cancer Register. I hope I was able to impart some information that will be useful to everybody on this forum. Thank you very much.
All right, all right. Okay, Dr. Little, you can stop sharing for us now. Well, I don't know about anybody else, but Dr. Little's presentation has left me somewhat in shock, because the thing that jumped out at me the most was about children as young as 5 years old, Dr. Little, can have testicular cancer. And I remember when my son was born, somebody asked, I think it was my mother who asked me if I checked if the scrotum had come down. And because I'm from a female-dominated family, I never had a clue about checking for scrotum and all of that. So I think it is very important at this time for us to reflect on the two presenters, the information that was shared, and how we can take away information from here, and we can go and share it with our groups. We can use it to empower ourselves. And this whole forum where we share information every month on the different types of cancers is not something that we should take lightly. And unfortunately, I had a discussion with Dr. Powell just before we went live about how unfortunate it is that too often persons do not share any interests or give due attention to cancer conversations, because it's not something that we are going to have. It is something that other people have until it gets to our doors. And that's one of the myths that we want to work on eradicating as we go forward. So this evening, it has been a great pleasure listening to both Mr. Miller and Dr. Little. And at this time, what we are going to do is to open the floor for persons to ask questions, to seek clarification, and for us to get the answers to the questions that may emanate from the two very informed presentations that we have had. I'm going to ask persons who are from the Foundation Executive, they can give an eye over at YouTube and see if there are any questions that we need to pass on over here. But as we go, what I want to start off with is with Mr. Miller. Mr. Miller, are you there? You spoke about the approaches that the Ministry of Health, and in particular the Westmoreland Health Department, uses in how you do awareness information sharing, especially as it relates to screening. And you also spoke about the culture that we have, wherein persons do not, out of fear or other factors, do not readily gravitate towards initiating the whole process of screening. So is there anything that you think of, Mr. Miller, that we could have been doing differently that could have had a greater impact? Where, for example, if we compare how things are done locally here in Jamaica, in Westmoreland, versus how it is done in a first world country, and whether if we gradually introduce how much of that you missed, how much of that you miss, whether we could get other persons, how we could get more persons responding to our outreach in terms of cancer awareness and health awareness as it relates to men's health. I don't know if you did you get all of that, Mr. Miller? Because I know I was muted at one point.
Yeah. In terms of what we could do,
Differently.
I guess, yeah. One of the things, yeah, man. Yes, I got the gist of what you're saying. Remember now our unit has the role of the unit, which has to do with helping people to take responsibility for their health through the health promotional efforts, which they building alliance with the media and also to collaborate with other agencies, just like how we work with you and we work with other non-governmental organizations as well as governmental organizations in getting the message out. I think more of that, more collaboration, more partnership. I think that is very critical given the fact that there's always not enough.
Samira, you went muted again.
So many health events that we have to focus on. So while we have to focus on the NCDs, there are other communicable diseases that we have to focus on. So partnership is, I think, is what we can do more, and we are getting better at it. Newton. So there is always room for more partnership, more involvement of other partners who have vested interests in the business of building the health literacy and helping our people to take a greater responsibility for their health. But we are working on it, and it's something that we are always committed to doing and willing to take suggestions with regards to that.
All right. Thank you, Mr. Miller. May I remind our participants, if you have questions, just use the raise hand icon. You'll be acknowledged so you can ask questions as it relates to both of the presentations, or if you had questions that you think were not addressed, I'm sure that both Dr. Little and Mr. Miller would be more than happy to answer your questions.
Dorothy, I'm responding to a question in the chat. Miss Powell.
Yeah. Go ahead. Go ahead, Mr. Miller. You want to answer?
Yes, I have seen a question in the chat.
How are we targeting
yes.
taxi bus drivers and teenagers?
We have brought services to the taximen them before. We have done that in the past. We have taken services to them in the bus park there inside when it was on Barracks Road. Yes, I'm answering now. I'm saying that we have even Negril and and we have also done that in Negril. So we have been doing that, and even Darlistan, we have brought services up there to them in Darlistan at the the taxi terminus there in Darlistan. So it's something that we do. The teenagers, yes, we go into school because schools are settings that we normally go to engage the boys. We have done numerous presentations on puberty in the high schools and primary schools. So we have been targeting those groups, sharing information with them, engaging them. So that is happening as we speak because we work very closely with the HFLE teachers. Sometimes they invite us in as guest presenters for their students. So we have been doing a lot of that, and we have gotten positive response from outreach activities with taxi men. Some of them would have taken the blood pressure, blood sugar. And even with your outreach, Dorothy, in September, we targeted the taxi men because where the event was held was just next door to the taxi stand. And we invited them. Some of them came over, had their PSA done, and had their blood pressure and blood sugar checks. So we have been really reaching out to them. We the issue of them responding in the way that we would like is not where we want it to be, but we have seen some incremental changes in
Mm.
our men's attitude, and I think that is commendable. But we have a long way to go in terms of changing some of these traditional norms, which I think are are major barriers to them accessing healthcare.
All right, thank you very much, Mr. Miller. I hope that Dr. Jean, that answers your question. And did you have anything you wanted to add to what Mr. Miller said, Dr. Jean?
No, I just wanted to know how are we reaching out. My second question, Dorothy, I think it's between you and Dr. Little, is do we have any statistics about the incidence or occurrences of testicular cancer for the parish or for Jamaica in general?
Just ahead of Dr. Little, I do not have anything as it relates to incidents. What we would have is mortality, because from RGD, what we get are mortality, not incidents. And that is one of the challenges that we have in terms of statistical gathering for Jamaica. Because we do not have a national cancer register, what we have are more mortality data rather than incidence data, because I think it's more the data that would be there as for incidents would have been more extrapolated data rather than raw data. I don't know if Dr. Little can add anything to that.
As I said in my presentation, the incident is so low, and it's a more Caucasian disease. So I think not much emphasis in terms of reporting things like testicular cancer is being done in Jamaica. I've not seen any statistic concerning Jamaica's figure. But as I said, it's a Caucasian disease. We see 1 and 2 cases in Jamaica, not significant. And it's less than 1% worldwide of all cancer. So that's why I think there's not much fuss about reporting testicular cancer per se.
Dr. Little, for those incidents where you talk about children having testicular cancer, would those exclusively be from genetics? Because what other factor would there be for a child of 5-year-old getting testicular cancer other than genetics?
Well, that I can't explain that.
Hmm.
That I can't explain. I remember this child clearly from Lakovia. You know, I cannot forget that child. So that's why I brought it up. I cannot explain. I cannot explain.
All right. Anybody else in any of the participants have any questions that you wanted to ask? Remember that if you ask, you learn more. Yeah. Has anybody seen any questions in the YouTube link?
No, there's nothing on the YouTube.
Okay, all right. Thank you, Dr. Jean. Dr. Jean, anything you wanted to contribute at this point?
I'm just worried with the incidence of STDs and things like that. And it's not just here in Jamaica, but globally, I would say, especially in the US, among teenagers. Well, I'm not sure what the STD rates are here, but someone who have worked in emergency departments and work in peds and things like that, we have high incidence of STDs among teenagers. We have herpes, we have gonorrhea, we have chlamydia, we have all of these things going on. And like Mr. Miller said, we have a thing among us as a people of color where our men are very stoic and our young boys are made to believe that they shouldn't complain and they shouldn't let someone know when something is wrong. How do we move forward and try to address these things? because eventually it's going to catch up on us. It might be a 1% now, but are we missing anyone in the process?
I think one of the interesting thing that or it's a comparable thing that I could look at. 10 years ago, when MistyBlue Cancer Care Foundation started doing outreach work in the parish, there was a lot of doubt in Thomas in terms of the impact we could have had as it relates to prostate cancer in particular,
Right.
because the responses over the years was not as encouraging. The engagement wasn't there. And I think for us, in terms of what we have experienced for the last 10 years is the approach, right? Because it was sort of taboo for you to think that men do not want to do prostate examination because they're homophobic. But what we found is wasn't homophobia that was a problem. It was lack of information or poor information. Yeah. So I think it's the same thing as it relates to testicular cancer or any other cancer, where is how the information is relayed to individuals that is going to make a difference. And if you couple that with what Mr. Miller spoke about the cultural lapse that we have in terms of willingness to talk about health issues where our males are concerned, not only those intimate issues, but health issues in general. And one of the empowering thing that we have been successful at doing is how we use children and females to support our males in getting awareness, and you have to take it on as a part of your family responsibility, wherein you go to the doctor and you need to do a follow-up, or you have symptoms that you need to stay mindful of. And sometimes you think that your husband or your partner should not be your child who you should monitor. But at the end of the day, if you don't encourage them as much as possible, then the mortality rate with whether it's going to be testicular cancer, heart disease, or anything else will continue to escalate. So it has to be a united front that we have when it comes on to awareness, and we have to keep chipping away at the awareness drive. The fear factor when it comes on to males, for me, some of the times also has to do with literacy. And sometimes because they're not able to express and articulate well, then they get aggressive, and the aggression sometimes comes across as resistance. When in truth and in fact, if you use a more soft approach towards them, then they open up and speak to you, because a lot of time the aggression is a front to them not being able to express themselves. I don't know if that is something that Mr. Miller or Dr. Little, either of you would have picked up, wherein sometimes when they come to the doctor's office, or you see them at health fairs and they are so aggressive, and you may get turned off, but if you take the time to speak with them, the aggression is just a front to the anxiety or the fear that Mr. Miller speaks about, and how we are then going to have to identify that as a cultural barrier, and how we are going to appease those barriers. Doc, were you saying something? I see where you were talking, but then it stopped.
No, I wasn't.
All right, okay. So if we have no other questions, I want to thank Dr. Little, thank Mr. Miller for your contribution, and for the participants who have shared and engaged, and even for those who have not spoken. We hope that the information that is shared is something that you'll take away and ponder, and do not keep it to yourself, but to share it, because when we share information, we're empowering those around us, And sometimes you may think that it is a trivial information for you, but it may be significant for somebody else. Encourage persons to go to our YouTube link, which is MistyBlue Cancer Care Foundation on YouTube. Subscribe and also look at the other recordings that we have there that we have been doing since February. And you can share those recordings in your church group, in your school groups, or your clubs and societies, so that the information can continue to spread and make a difference. Sometimes it's not a whole lot of persons who are going to benefit at any one time, but it is that one person who needed that information that could have made a difference. Because just to retract a bit, when Dr. Little spoke about the swelling in the breast, because sometimes Dr. Little, the breast, especially with male boobs, you see with the male boobs, sometimes it look like it is fat, but sometimes you're saying it could actually be swelling rather than fat, because a lot of men nowadays, you find them having man boobs. So how do you differentiate a little between the man boobs and the swelling?
That's an interesting
Yeah,
question,
because,
Dorothy.
it
That's
is.
interesting. But it can be a warning, as I said.
Mm.
Young men who come to my office saying that, boy, their breasts, I always tend to examine their scrotum. That's part of it. And it has become a regular practice for me to keep doing it. So that's why sometimes it's hard in terms of, say, missing this situation where, they are developing testicular cancer, and, they came in with breast swelling and you didn't do an examination to find out that was the problem.
Doc,
Mhm.
question, especially for the younger one, the males, when you make a suggestion to somebody to do to examine their testicle, is there any resistance? Do you ever have anybody
There's
who say
always there's
no?
always resistance,
Some of
Dorothy,
them
but
say no, they're not
is
doing it, Doc.
that is how you have the schoolers are the one them which give you the most problem. The
Hmm.
schoolers, yeah.
And
The
they tell you
school.
no upfront. Is it because
They
you're
will
a
say,
male,
but
or is
but
it
but
because you're a male?
persuasion. I don't really have much problem with my patient them,
Hmm.
because there's always a way to get around them.
Hmm.
I have a question for Dr. Little. Maybe I am overthinking things or I'm seeing things that are not there. But have you seen lately that in the last year or two, maybe 5 years, that there's been a mass increase of men with these engorged breast tissue?
Men with breasts, large breasts.
Yeah.
Yeah, it come as a form of with obesity, because we are getting a very much obese society, and we are seeing a lot of situation, young people, and
Yeah.
especially after this COVID, if you see a lot of these young
Yeah.
boys, it
Okay.
is so shocking. It is so shocking.
Mm-hmm.
We are in a crisis in terms of obesity, and that become as a part of the whole obesity syndrome.
Right.
And it's just sitting at home eating those hormonal chicken, they will eat 3 4 KFC for the day, you know and this is basically what is happening. Yeah, I'm seeing I just mentioned in the last 3 4 years with COVID that contribute a lot to
Okay.
sitting
I
at
thought I was the crazy one. So
no, it's a fact. It's a fact.
Dr. Leggett Dwight is asking you if it is more obesity or hormone imbalance.
But that could
Wasn't a question.
yes, yeah,
That
but
it
it's
is
not
obesity.
the whole idea is that hormone balance is there a long time.
Mm.
So this sudden increase that you're seeing, and there are situations in terms that you can attribute to this, uptrending in obesity. Yes, we have a few that have hormonal problem, but hormonal problems there all along. But all of a sudden, especially after COVID, you know, there's a mass increase in obesity, especially in young female and male.
Well, as parents, as teachers, educators, and health workers, we have that duty to make sure that we share the information to see. Dr. Little always tell me, Dar, we just need to save one. I get miserable sometimes and said, we don't get enough and whatever. He always said, let us aim for one. And once we save one and everybody save one, then it will make a massive difference. All right. So I hope, like I had said before, that at the end, know that somebody would have learned something tonight that they never knew before. And that what you have learned tonight, you will share it with somebody else and allow the process to continue where it makes a difference in terms of what we do as a community and how we make a difference, all right? So thank you very much for the part that you have played, and we look forward to having our next forum for the month of May. Stay safe, and God bless you, and thank you very much.
Okay,
Good
God
night.
bless. Yeah, good night.
Night, night. Thank you. And I must say thank you to Shelley Jones. You have Kay, Julicia Williams, Fiona Smith-Bird. And there's another lady who's there and she's gone. Thank you very much for attending, and I hope you all found something, and Kay, you heard something that was edifying to you and it was worth your time logging in. All right.
Good
God
night.
bless you.
Come on. Thanks. Good night. Blessings.
Thank you, Mr. Miller. We'll speak. Hi, Nicole. How are you? Thank you, guys. We're going to log off now. Bye-bye.